Well, we might make a start. Thank you for coming to this morning's session, this roundtable from signals to solutions, scaling effective online PCVE programs across complex digital ecosystems. My name is Mark Duckworth. I'm the moderator today, and I'd like to introduce Matteo Vergani from Deakin University, Teresa Raja from Moonshot, Manisha Bika from Department of Prime Minister and Cabinet New Zealand, and David O'Brien from Yorktown Family Services in Canada. What we're going to do this morning is each of our four panelists will speak for around 5 minutes, and then we'll have a little bit of discussion about some of the issues raised and then open for questions before we finish at 11. And the order of our speakers will be Matteo and Teresa, who are here in the room today, and then Manisha and David before we move on to the moderated discussion. So without further ado, I will hand over to Matteo to commence his opening remarks.
Thank you, Mark, and thank you, Teresa, for organizing the roundtable discussion. Look, when we talk about interventions, I think, first of all, we need to understand that we have to monitor, right, what happens online. Otherwise, how can we deploy our interventions well? Well, monitoring, look, it depends, of course, on what we're interested in. If we are looking at very small groups and very specific groups, maybe human eyes are enough, okay? But if we look at vast scale digital platforms, like where millions of contents are uploaded in very short times and continuously, well, we need machine eyes to look at that, right? We need artificial intelligence. Now, we often talk about artificial intelligence in very abstract terms, but the problems that come with monitoring extremism using AI are often very technical. So I'm going to throw a couple of technical issues and the solutions we have found in our lab. Look, maybe they're not the only ones. Actually, I'm sure they're not the only ones. But let's say 3 issues I want to talk about are, first, defining what extremism is. Now, it seems easy. Well, kind of we know, we have many definitions, but how do we teach the AI to identify extremist contents? Well, there are like different ways to do it. You can identify extremist people, you know, and then tell the AI, well, learn what they say to understand what is extremism. But it doesn't really work because extremist people many times publish things that are not extremist at all. So that would teach the AI that extremism is something that is not. A better way to do it is certainly to look at what is manifested in social media contents, like in a video, in a text, and then you have experts annotating that content and telling the AI, this is extremist, this is not extremist, learn the patterns. Now, clearly there is a gray area because extremist people try to write extremist things in ways that are not detectable to access mainstream language and mainstream discussions. So this complicates things. So of course, one of the main challenges when you develop a machine learning classifier to detect extremist content is to not over-include lots of people who are not extremists. Because of course, extremist people try to use more mainstream content. The second problem is that there are not many examples around. Now, of course, we have showed examples over the course of the conference, but to train an AI model, you need thousands and thousands of examples to train it well. And these examples are not, they just do not exist in social media platforms, in most of them. I was looking at the presentations across the whole conference. Look, I had seen tiny numbers. Like when we talk about Telegram channels, or even TikTok videos, of course there are examples, but you don't find a lot of content or enough content often to train the models. And the third problem is finding a suitable control group. So you have to tell the AI what is extremist and what is not extremist. Now, you cannot give the AI children's books. You have to give the AI, like, for example, anti-immigration language or opinions that are not extremists, and then anti-immigration ideas that are extremists. And this poses a long list of challenges, conceptual and so on. So the approach we have is to we abandoned the idea of having one classifier that captures extremism. It's just not feasible. You have to look into specific areas. So in some Telegram channels where specific social movements are, well, for those specific contexts, you develop classifiers to capture what in that context is the content you're looking for. Maybe white nationalist content, or maybe references to sovereign citizens ideology, whatever you're looking for in specific places, which means it's a very expensive and time-consuming process. So just to conclude, it is possible to separate signals from noise to monitor extremism. We have to use AI because we need machine eyes to go through vast volumes of data, but it's not that simple. And to train an AI model well, there are lots of conceptual and technical issues that need to be addressed carefully, very carefully.
Thank you, Teresa.
Thank you, Mark. Thank you, Matteo. Hi, everyone. My name is Teresa Raja, and I represent Moonshot. I'm based in London at the moment, but I'm originally from Melbourne, so it's lovely to be here, but also I'm losing my voice as a result of the travel, so please excuse the croakiness. In terms of what we were hoping to get out of the discussion today, the insight that I'm hoping to provide is around the work that Moonshot does in the online space, which they've been doing for about a decade now, and it's essentially around online violence prevention. And it's such a pleasure to have Manisha and David here on the panel with us to speak to the kind of the work that we do in practice on the ground in terms of how it works across government implementation and delivery, but also through community service providers. For Moonshot, the work that we do, especially in online violence prevention, is ultimately about secondary prevention at scale. So we reach vulnerable or at-risk individuals online, and it's around reaching people before they mobilise to violence and operating outside the criminal justice system. And so what I'm sharing really draws on our work primarily in Canada, New Zealand, and the US. And so this is work that's an operational reality, that these aren't just theoretical frameworks. The fundamental problem we're addressing through the work is that every recent act of terrorism and targeted violence has first passed through digital spaces, and this is what we've found. And we've heard over the last couple of days all the examples around what we're seeing in terms of trends, what we're seeing in terms of the scale and the severity of the issue. But what we do know is that those warning signs and concerning behaviours appear online well before law enforcement is even aware these individuals exist in many cases. And so the issue is that our prevention systems remain primarily offline, and it's creating that disconnect with the online space. And this isn't to say that there aren't very critical offline programs that are working, that are successful, but for us it's about trying to digitize that bridge between the online to offline. The work fundamentally focuses on the concept and this kind of change of theory that we can reach people in digital spaces where they're most vulnerable to harmful content online, and that we can intervene early with very genuine offers of support. And so this is about ensuring people don't have to feel that violence is their only option. So we connect them to trained professionals who can address those underlying drivers like isolation, anger, loneliness, and depression, and lack of belonging, which we've heard throughout the last couple of days as being kind of critical unmet need. So we're not, at the end of the day, we're reaching into these online spaces and we're connecting them to offline support services, but we're doing this in a way that's tailored to every single geographic context that we do deliver in. So we prioritize working with local subject matter experts, local services, and the kind of expertise from local agencies to tailor the way that we actually offer people support. This is the kind of critical point around how you ensure that people feel that they can trust this offer of support that they're seeing online. From our last decade of work, what we're seeing is that hate speech isn't just about content, it is about this kind of unmet human needs. And so the research shows that people who engage with violent ideologies and consume extreme content do so because of these kind of three interconnected factors: need, narrative, and network. And they kind of speak for themselves, right, in terms of people who are going through very kind of emotional suffering and seeking belonging and significance in society, looking to narrative where they feel that this kind of black and white simplistic thinking tells them who to blame and what to do about it. And then networks, so seeking out human connections and then being propelled and embedded into some of these worldviews. Ultimately, the messaging that we offer when we reach people online, it's about showing that we're not judging their beliefs, we're not trying to stigmatize their behavior online, but it is their behavior that indicates risk for us. It's not the ideology and the beliefs. So we're offering support for underlying psychosocial issues that drive them towards violence in the first place. And so it's not just about needs, it's also about, it's not about narratives, it's about needs. We work with two distinct audiences, so that's at-risk or vulnerable users online, but also concerned bystanders or loved ones. So we do this kind of in parallel. We deploy targeted digital advertising across 20 plus platforms, but it's very specific usually to the country that we're operating in, where we think we're going to have most engagement and impact. So that could be Google, YouTube, all the way through to TikTok, Reddit, and niche platforms like Rumble, Telegram, and 4chan. In terms of the messaging approach, it's about being, again, non-judgmental, non-stigmatizing. And so we ask questions. So when someone searches something very extreme or they're consuming extreme violent content, the advertisement that they're served with essentially asks them the question of, are you feeling isolated? Are you dealing with overwhelming anger? It's okay to need support. And so we're not labeling people here, and people feel quite confident that they're able to anonymously access support services. And so that could be through text, chat, email, or phone. And that's through very tailored bespoke landing pages that we create where people click through to a website and are able to consume information about the service they're about to receive, why they're seeing these ads, and people often spend a lot of time on trying to understand their kind of privacy and ethical kind of considerations and rights. So it's about ensuring that people know that even if it's government funded, this is not attached to government, and you're not going to be reported to police unless you pose an imminent threat to public safety. With bystanders, we find that parents, teachers, family members, peers, friends are often the first to notice concerning behaviour, and they're desperate for help. But there's a number of barriers around being concerned about not being taken seriously or police being called and their loved one being arrested. So what we're doing is providing information that is safe and accessible for them, but starting to empower them with the information to do what they need to do, whether it's in an immediate moment of crisis or somewhere down the track where they're seeing someone who's presenting as at risk. In terms of bystander engagement, we've had a lot of impact across the different programs, especially in the work that we're doing in New Zealand. There's been a huge uptake and engagement with people who are seeing ads and who are really concerned and want to go through to contact a service provider that we've trained up on the ground who's working in the kind of violence prevention space already. So we train up service providers who are working in family violence, drugs, and other social welfare support. People who do this job incredibly well, but benefit from the added layer of capacity building that we provide around understanding the violent extremist space and what to expect when people present who have been coming through this pathway online with an interest in a specific ideology or form of violence. In terms of what works, what we're finding is that no matter what the kind of violence or extreme content that people are consuming, and we've talked a lot in the last couple of days about the blurring of the lines. We're talking about, do you throw ideology out the window or not? Regardless, for us, this work is founded on the finding that the language, the messaging, and the unmet need stays the same. And so people are responding no matter what they're searching online, whether it's extreme gore and violence for the sake of violence through to very specific ideological content, they're responding to these ads that are asking them and offering them a genuine moment of support in a moment of unmet need. So, for example, in New York in 2024, we had a young bystander who contacted one of the service providers that we work with about their roommate, someone who was increasingly speaking about a bloody revolution and had made several concerning statements and demonstrations about demonstrations surrounding the Israel-Hamas war. So though the bystander wasn't concerned about an imminent threat to their safety, service providers assessed that this was a potential imminent threat to public safety, and they escalated this matter to law enforcement. Service providers continued to engage with the bystander to ensure they received adequate support throughout that process. And what we found is that in the end, there was an individual who was enrolled in a service. It's all completely voluntary, but that person was enrolled in the end. And this is an example of how this works in practice. And David would be able to speak to more detailed case studies, especially in the Canadian context. So long-term trust building is possible. And what we're finding is that addressing those psychosocial factors really does have an impact. How am I going for time? I haven't seen any kind of red card.
No, we're probably towards another 30 seconds.
Oh, 30 seconds. I can do that. I have a slide that says 30 seconds. I can do that. So why this work matters, I mean, what we know is that there's a critical infrastructure gap in terms of secondary prevention. We do have a lot happening in the primary prevention space. We've got a lot happening in tertiary, which are all incredibly effective, and there are so many examples of that here today. But we find that often there's that leap that misses the secondary space. And for us, what we're finding is that there's a real return on investment in terms of efficacy. At the end of the day, the numbers do add up. Prevention costs a lot less than responding to attacks and actual moments of crisis across the community. And so we're finding that governments are really seeing the value of doing work in the secondary prevention space and doing this with really trusted local service providers in their geographic contexts. The work isn't experimental. We've been doing this for almost a decade now, and there are multi-year programs across these different countries which demonstrate that measurable impact. But of course, it's an ongoing process in terms of ensuring that we're always innovating and able to tailor the work that we're doing to respond to what we're seeing online and the support that local service providers need to be able to provide wraparound support that's effective. So in kind of closing off, what I will say is that this work, we don't have to wait to do the secondary prevention work. We don't have to wait for tech platforms to do this because that takes time and it has its own inherent risks. This is work that's proven that we can do now that we're doing with governments. So really grateful for the partnerships, those of you who are in the room, but also online who do this work with us. And, you know, we're always open to other people's ideas and feedback as we continue to improve this work. Thank you.
Thank you very much. Manisha, your comments.
Well, kia ora koutou katoa. Ko Manisha Bika tokoinga. I'm Deputy Counter-Terrorism Strategic Coordinator at the New Zealand Department of the Prime Minister and Cabinet. Just to say thanks to the organisers, to Avert, for the invitation to be on this panel, and I'm really sorry to not be there in person. It looks like a fantastic program, but I am really grateful to contribute virtually. I'm probably going to zoom out a bit, I think, with kind of a government perspective on kind of our prevention work, kind of from a strategic sort of lens. Thinking about our work in New Zealand, we have just completed a huge amount of work updating our countering terrorism and violent extremism strategy. And three of the kind of key sort of pieces of the nature of the challenge that we've identified through that work has been kind of the continuing challenge of youth radicalisation, the continuing challenge of what NZSIS refers to as mixed, unclear, unstable ideologies, and then the challenge, I guess, and sort of the focus of our sort of discussion today around the online environment influencing radicalization, but more broadly, the challenge of emerging technologies, AI, the way it's used for influencing both radicalization, but also capabilities for those that might participate in violent extremism. I think for governments, I think there's a real challenge that a lot of our systems have been designed for a really different type of terrorism challenge. And in our current environment, that those previous challenges continue. We continue responding to faith-based violent extremism. We continue responding to white identity violent extremism. But we have a whole lot of new and complex challenges, the challenges of mixed, unclear, unstable, where a lot of individuals we're seeing are violence fixated first, and then looking for ideas and ideologies to kind of rationalize their engagement in violence. Our CT strategy, it continues a strong focus on prevention, and we kicked off a lot of our prevention work back in 2022, and I'll talk about that because I think the journey of that work is just as important as the output. We took a co-design approach to that work, pulling together a multi-sector working group and working really closely with civil society, communities, academics, researchers, and government agencies, bringing us all together to develop our priorities for prevention work. And I talk about this because I think it was really important building trust and confidence, and really importantly, some partnerships with other sectors that I think as government agencies we hadn't necessarily worked together that intensively with previously, and it was the beginning of some really interesting and exciting work over the next few years that progressed. Now, as part of that, we also did some really intensive engagement with at-risk communities, with Muslim communities, Jewish communities, a whole range of faith and ethnic communities, LGBTQI and rainbow communities. And one of the common themes that really came out of a lot of those discussions is around the challenge of misogyny, and most, if not all, ideologies having some form of kind of misogyny as an element to some of those ideas. And I think this is a key challenge for us in our prevention work, particularly in responding to gender-based violence. And I think this becomes more and more acute as we think about the challenge today of groups like 764 and the COM as well in our work. And I talk about this because we are really fortunate to have a Preventing and Countering Violent Extremism Fund, where this was a 3-year fund. It unfortunately concludes this year, but kind of gave us sort of 3 years of being able to fund some really interesting, innovative and important projects that were delivered from outside of government, so through civil society and community organisations. Now, at the beginning of the fund a couple of years ago, it was sent out, the information on the fund was sent out to the Family Violence Clearinghouse, which is a network of New Zealand organisations working in family harm community service providers. And we got some really interesting projects from those organisations who I think were kind of newer to working in this area of terrorism and violent extremism prevention. But those projects are some of the most interesting projects that I think that we've had, and I'm really grateful to their perspectives that they've brought to maturing our work in this area. They're so very experienced in understanding and responding to misogyny and gender-based violence, and have really added a lot of value to our community of practice that we've been building in this space. Now, the fund each year matured in terms of kind of becoming more focused, learning from the projects that we had, and then responding to the shifting and changing environment. And in the final year, focused on 2 priorities around supporting disengagement initiatives, so those that are kind of targeted at-risk individuals, and supporting online initiatives. One of the projects that we funded in the last year is a Moonshot Redirect pilot. So great to kind of have Teresa and also David to kind of talk about sort of some of the Moonshot work internationally. But this particular pilot sort of does both. It addresses both of those priority areas for our fund, but really importantly, it partners with a domestic family harm community service provider organisation who provide the local support to vulnerable individuals through the Redirect project. I think it's a really good example of an international and online organisation like Moonshot connecting with a local and grassroots delivery organisation, like the community service provider that is delivering the kind of support services for individuals. And I think that's one of the key things that we've been talking about too with a lot of our international counterparts, including Australia, who we work with closely through the Australia-New Zealand Counterterrorism Committee. But is how we work.
Manisha,
yes.
Could I ask you just to conclude in a couple of minutes, a couple of seconds? Thanks.
I will do that. So I think just to sort of summarize, I think we're all thinking internationally about how we now look at what's working internationally and which of those initiatives we look to scale. And more, I think part of our challenge is to work more and more like the tech sector, where we're testing, failing fast, learning, iterating, and then scaling. And that's part of our challenge for repositioning our prevention systems, needing to become faster, more agile, connecting the online to the offline, connecting the global to the local. And just, I guess my last point is that the solutions are always local. Kia ora, and thank you.
Thank you very much. David, your comments.
Hi, nice to see everybody online. It's the middle of the evening here in Toronto, Canada. So my name is David O'Brien from Yorktown Family Services. Yorktown is a typical, what we would say, mental health community health center based in Toronto, which is Canada's biggest population base, 2.5 million in the inner core. And then the GTA Greater Toronto area is about 6.5 million. In 2020, we developed a program called Estimated Time of Arrival, which is essentially a psychosocial intervention program that engages individuals on the pathway or engage with violent extremist activities. Since 2020, we've engaged with over 400 individuals, with about 30%, we would say, as radicalized to violence or mobilizing towards violence. Majority of referrals since 2020 have come from our national security apparatus. Referrals can also be made at the local level in terms of regional policing, but also family members and bystanders can refer to us. The main objectives of the program is really to help people disengage with violence. And so I know there's always a lot of debate about ideology type. And when we started the program, we tried to wrap our heads around what ideology somebody was, and realizing at the end of the day, our business is really, really behavioral change. And so people that are violent or have violent rhetoric, what's underneath that, what's driving that is our business and interest. And, we can get lost in sort of what people are engaged with, which might be important to build relationships with and maybe do some validation. But beyond that, we're looking at to help people disengage with violence. And so basically we do that through a variety of means, and we're funded by Public Safety Canada's Community Resiliency Fund. And so when we have an individual that comes to us either through the Moonshot pathway or other pathways, is that we wrap around interventions around individual. And so that can include counseling, psychotherapy, which can also be family. So we engage with families also too, or loved ones that are concerned about the individual, and we also engage with the individual. What might be unique about our program, and at least in Canada, is that we offer spiritual care options. And so often the individuals we work with in this space are really confused around identity. And so, of course, they engage with these ideologies to fill that identity void. And so also religion is a big issue here. Most of our individuals have learned Christianity or Islam through ISIS-inspired websites or white national Nazi websites. And so we try to help kind of deprogram that. So we have an imam on the team and a Christian minister. We also offer outreach opportunities to help people to re-engage with their communities in terms of employment and volunteerism, peer support, people with lived experience that, may have some kind of way to build a relationship with somebody because that shared common experience. Of course, that individual that's on our team is recovered and has moved on. We also have child development staffing. And so we've done a lot of repatriation from Syria and Iraq and Afghanistan and kids that are Canadian citizens, but maybe born in those ISIS detention camps repatriated back to Canada and Toronto. And so working on some of the trauma needs for children. Also, maybe growing up in a home where extremist ideology is sort of circulating. One of the things that to be clear about is that about 30 to 35% of our individuals are radicalized to violence, are on the pathway, have fantasies about hurting people, and also, at times even mobilizing towards violence. And sometimes in Canada, it's difficult to arrest somebody or have enough evidence to do that. So rather than have someone roam around with no support, our intervention definitely plays a part here. We met Moonshot in 2021, and a quick funny story is that we said to our team, we know violent extremism and individuals who participate in it live online, right? And so no one ever comes forward, to our office and says, I'm involved in extremism, help me. That's never happened. So we were trying to find a way to kind of get online. And so I actually said to my staff, just go online and give a flyer to our services and go on the dark web and do all these things. And that was crazy. So about 2 weeks later, I actually got an email from Moonshot saying, actually, they've developed a whole strategy and infrastructure and intervention on how to do that. So since 2021, and we started our project with Moonshot in 2022, we can safely say we've had about 50 meaningful clinical engagements or interventions with individuals in the Toronto area through the Moonshot pilot. One in particular of note that was of concern to us, and I think this is something, one individual committing an attack, even harming 2 or 3 or 4 people as casualties, can have profound impacts on communities. And so this individual saw an ad, one of the Moonshot ads, clicked on it, and ended up in our services and in a chat room with one of our engagement workers. And so they chatted for a few months on and off. And what came to light during those chats was that this individual had plotted and planned to get a van, to get a truck, and find women and run women over. And of course, 2016, 2017 in Toronto, we actually had that happen. There was an incel attack, incel-inspired attack. So this individual was inspired by that attack in Toronto. And so through that relationship online, we didn't know the person's name for several months, finally began to feel that they could trust the worker that was engaging with them. They built a rapport, and then they moved across our pathway into more intensive services, into psychotherapy. And then from psychotherapy, we then moved into psychiatry. And so the individual continues to talk to us now. They're employed, and they're continuing to engage with our services. And that was about 2.5 years ago, we engaged with them. So, even if it's one individual we save, we actually save the ecosystem around them in the community and keep our public safe. And so it's really important that, we're definitely, online. We are starting to see some recruitment offline, more so than we did maybe 2 or 3 years ago. But the online component is still engaged with that. And so there's still those communities online, even if you're recruited offline, that perpetuate or facilitate those kind of people engaging with those communities. So all to say, the importance of really seeking these individuals out ahead of time and engaging with them in a really non-threatening way. And the example I just provided really demonstrates what the power of what can happen. Thank you.
Thank you very much. We've got about 7 or 8 minutes left, so we might, if people might have time for a couple of questions. If does anyone have a question in the room, which I'd like to ask? Yes, Michelle, yes.
But I don't want, if somebody else has...
No, you're the only one who put up their hand at that point, so you're first in, best dressed.
All right. Look, again, 2 very quick ones. Teresa, where you refer somebody to a service, I'm thinking about people in rural regional areas. Let's say you refer somebody to a service or need to refer somebody to a service as part of the online redirect, only to discover that there are no services in their local area or that they're going to have to travel 2 hours to access the appropriate service. Does this provide an opportunity for a kind of read back on resourcing needs and issues to your funders? That's question one. The other question, which I don't think we're going to have time to get to, is whether our concept of behavior is too kinetic. But we might leave that and maybe just focus on the first question.
Okay, saved by the bell. With the first question, definitely, I think, I mean, we do our best to ensure that the way that the service providers are set up and then trained is that they do the kind of training onto their networks of service providers so that there's a bit of a net for people to be geographically dispersed in terms of who's coming through, but we are definitely finding that there are gaps. And what we keep advocating for in funding the ongoing programs, especially beyond the pilots, is for an expansion of those service provider networks across the different spaces. So in New Zealand, we're very lucky that they have such a well-built network and system so that we've had a really good spread in terms of people from all across New Zealand being referred to the right service that might in most cases be in their geographic area. But in other areas, we're much more limited. So in Canada, we're looking to expand and we're having a lot of reach where we are across, I think it's about 5 provinces, but it's different when it comes to the rest of Canada. So this is where we have to constantly advocate because there is a gap.
David, do you have any comments on that?
In terms of the geographic scope?
Yes.
Yeah, so we cover the province of Ontario through the Moonshot pilot, although there is remote regions like in most countries where it's difficult to access individuals. And so we've actually flown up to like the furthest part of Ontario to engage people, not through the Moonshot pilot, but through another project we were working on. So definitely, I think just in general, healthcare services around the world and remote communities is a big issue. And of course, isolation is a big issue too, and resource deployment.
Thank you. Is any more a burning question anyone has? Because we're getting close to the end of time here.
And if anyone has any specific questions about the programs or anyone else that's here, please come to me and I'm happy to put people in touch.
Yep. Well, this is a mammoth topic. We could have spoken about it for much longer, but we are now at 11 o'clock. So I would like you, if you could thank Matteo, Teresa, David, and Manisha for touching on this incredibly important set of issues and involving much more consideration at a future time. So thank you very much.